Hi, my name is Hari and I head CallHealth. I've had the pleasure of taking this company forward over the last 3 years. CallHealth, as most of you would know, is the world's first platform that integrates everything about health. And what I mean by that is that we bring forth an opportunity for a customer to get an access to any kind of healthcare service on the CallHealth platform. Now that means you could do this virtually, which is you could do it through a mobile app or a web, or you could connect with CallHealth on a voice call and seek any kind of service. It could be a doctor consultation, it could be diagnostics, it could be a DNA mapping, it could be an assistance in maybe the eventual mortuary related services. So what CallHealth is trying to do is to bring forth a single point of access for any kind of healthcare requirement. The background to why CallHealth started out in this particular way is we realized that we currently live in a highly integrated ecosystem, highly fragmented ecosystem, and we at CallHealth are trying to make sure that the data points that come out of every medical touch point, every clinical touch point, is integrated so that people can find meaning, not just in terms of an episodic curative play, but trying to see how to take that forward in terms of a preventive or a predictive kind of a play. So the ability to stitch together multiple data points is what CallHealth brings to the table. So it's not just a question of access to the professionals, but it is actually a question of how do you stitch the data together so that people can find meaning on that. Now, from a provider point of view, which is either a doctor or a hospital or a lab or a clinic or a pharmacy, what CallHealth is trying to do is to break the boundaries that they used to operate in. CallHealth essentially gives them customers from much larger geography beyond the current limitations that they have. So in some sense, to the provider ecosystem, we are actually providing an opportunity to enhance their capacity, to optimize their capacity better. And so we are not really building any capacity. We don't have hospitals, we don't have labs, we don't have clinics. What we actually do is take the existing ecosystem, connect that to the existing customers out there and say, hey, you can get across to them anytime you want from wherever you are, which wasn't the case in the past. And so that's what CallHealth brings to the table. So traditionally, if you look at it, most other industries have been disrupted by technology. We have actually had whether it is food, entertainment, e-commerce, we have found multiple technology players who have brought forth solutions that enable you to experience a product, to procure a service without really having to step out of your home or with the minimal inconvenience. However, healthcare traditionally remained in its old brick and mortar form. And of course, most of us have got used to meeting only a particular doctor because he was the most convenient to access maybe 3 streets away or 5 streets away. What technology does and what we believe CallHealth is bringing to the table is that you are being given a larger set of choices to choose from. So today you can talk to a doctor in Mumbai for a second opinion, which traditionally would not have been possible. And you could have a family doctor sitting out of Nagpur for somebody in Hyderabad. And you could have unlimited number of calls to make it happen. One of the biggest hesitations that people have is when it is virtual, can the doctor really understand my problem? And which is why CallHealth was probably the first company in the world to bring forth what we call as a physical intervention along with a virtual consultation. We actually had a nurse who would come home and there would be a triage between the patient, the nurse and the doctor, so that the nurse acts as a physical sensor for the doctor to say, okay, can you please check this for the patient? Can you please let me know what is the temperature like? Can you tell me the level of flexibility that the patient has? What it does is to kind of eliminate some of the limitations that a pure play virtual consultation has, and we have brought that element into our game. And again, when you look at this, to do a fasting blood sugar or an HbA1c or a glucose tolerance test, traditionally people would go to a lab and sit there for half an hour or 45 minutes to get it done. In the case of a GTT, you sit in there for 2 hours or 2.5 hours. Today you can do those things at home, which means there is convenience and it allows you to order such a service at the touch of a button. I believe that in the last 2 years of testing that we have had, we have seen 40% of all diagnostic tests being self-prescribed. These are chronic patients who are now starting to be more regular in the way they do tests, which they used to procrastinate or avoid in the past because they had to physically move out. I believe technology will bring that change. It will take a bit more time because it is healthcare, but it is inevitable that that adoption will be very rampant once the tipping point is reached. See, in the Indian context, the other issue that we are dealing with is access to health, especially beyond the cities. 70% of India's specialists are living in the urban cities, which means, whereas on another context, 70% of the Indian population lives outside the urban context. So how do you access the doctors with minimal inconvenience? And one of the things CallHealth is setting out to do is create something called a health hub, where we are actually going to have little kiosks, which are like an online to offline engagement model, which will be there in what we call as the rural and remote locations, where people could just walk in and connect to a doctor in the city and have a conversation. This could help them handle issues relating to getting in touch with a specialist and deciding if they need a particular treatment or not. And at another level, and this is another big issue that India deals with, as you know, 68 or so percentage of the people who undergo any kind of healthcare treatment do it as an out-of-pocket expense. It doesn't come through insurance, it happens out of the pocket, and many houses get wiped out practically because of the debilitating costs of healthcare. Oftentimes, the breadwinner is the one who is unwell, or the breadwinner is required to travel with a dependent to be able to do this in different cities and so on. So CallHealth has introduced what we call as a facilitation service. It is a no-cost service. We actually help take a member from place A to place B. Only the service cost of maybe a travel has to be provided. We ensure that there is minimal waiting time, there is complete control and care being provided, and get the person back to the place from where they came. All follow-through consultations, for example, if you do a TKR or a hip replacement, all follow-through consultations can be virtual. So you don't have to stay in the urban context for 2 weeks, but you could actually go back as soon as you are capable of doing. I believe things like this are the benefits and differences that CallHealth has been able to provide, and we are hoping that this can be very quickly accelerated into different parts of the country as we get started now. See, I think the true benefit of a platform is when you are able to provide people an alternative to the traditional excuse they would have had. I just don't have the time to do it. If you can find a way to eliminate it, there is a very significant possibility that you will actually get people to do the tests well in advance. So we are hoping, and we have seen that happen over the last couple of years, we are seeing that there is a tendency to now be focused on preventive care. People are actually starting to look at an early diagnosis, try and catch the issue before it really grows up, especially for chronic patients who have like let's say a diabetes or a hypertension issue. We have seen that people are doing ECGs more regularly now at home. People are doing HbA1c tests regularly at home and so on. What it means is that there is an opportunity that you can catch the disease before it becomes something bigger, escalates into a bigger issue. And that itself is a big cost saving play. The second point is there are issues people deal with. It could be around what I call as emotional well-being, the whole idea of what kind of a mental framework you are in, depression that you deal with and so on. Traditionally, you never felt good walking up to a psychologist or a psychiatrist, and you don't want to be seen in those places. Today, a platform like this provides them the privacy and convenience of doing it from home. And sexual diseases, I have noticed that there is a lot of hesitation to go and talk to somebody around those into a clinic, but you can do that from the convenience of one's home. So you have your privacy, you have your space to deal that in. So I believe that platforms like CallHealth, and in particular CallHealth, has seen a significant adoption because of convenience and privacy that we provide. And I think that's going to be a big advantage to people in the urban and semi-urban context. See, from an adoption perspective, I think there are two big things that we have noticed in the last couple of years of testing that we have run in the 13 cities that we operate in. The first thing we noticed was that more and more women are calling in and coordinating, and my healthcare colleagues tell me that the percentage of women that bring a patient into a hospital, a brick and mortar hospital, is usually in the 30% and 40% category, whereas in CallHealth we have noticed that we are hovering around the 60% category, which means we are empowering the one at home to coordinate services and releasing maybe some of the other pressures that people are dealing with. So I think that's one big adoption we notice, and that's a differentiator for us. The second differentiator we are noticing is we used to have repeat usage of 20-22% in the past. Today we have seen usage of anywhere between 65 to 70% of repeat usage coming in from existing customers, which means once you use it, we are starting to see more and more people come in again and doing that. So it could be ordering medicines, doing tests, having doctor consultations, or doing physiotherapy multiple times across the year. So those are two big things, and the most important thing in all this is the underlying health records are captured well. So you always have a reference point to your health records digitally, and you can show it to any doctor at any time in any place. And you don't have to worry about, oh my God, did I carry it or not? If you have a smartphone, you can just open it and show it to the doctor saying, this is what I did and these are my parameters, or these are my improvements. So what we have truly done is to bring forth an empowerment, and we are seeing a significant repeat usage based on that. CallHealth's strength comes from the fact that we have brought the entire healthcare, both access and data, using the technology that we bring in. Now what it does is to provide significant capability for us to analyze both at an individual level and at a community level. And let me explain to you what I mean by that. For somebody who has done a certain test, let us say multiple times in a year, maybe 3 or 4 times in a year, they have done a certain test, we are now able to start seeing patterns of whether it is moving up or down, and we are able to bring an information back to the customer saying, hey, we are starting to see this move up, and you might want to therefore check on what else you need to do. Or we are actually able to start telling them saying your parameters are starting to go down and come down to normal, which means continue the practice. So we are able to incentivize and alert as needed. So that's a big advantage we have brought in. We are integrating that with a doctor consultation and so on, so that we are able to provide them a value added attention to what they do. But even more importantly, at a community level today, in the cities that we operate in, I am able to see what kind of health issues prevail in what kind of geographical pockets. And that's a phenomenally interesting output that we are starting to see. We are starting to see heat maps of, let us say orthopedic issues or cardiac issues or other related health issues. And we are starting to see patterns across different places, communicable and non-communicable diseases. And that's because we have data of people ordering medicines or ordering tests or talking to a doctor consultation or doing a continuous care. All of those data is going into the system, which gives us a visibility as to what is happening in Kukatpalli and what is happening in Gachibowli or what is happening in Vijayawada. And that's another powerful play that we are bringing to the table. And as more and more customers start using it, we believe that the technology we have will actually give us a heads up or an alert on potential illnesses or diseases that may be starting to kind of pick up, or epidemics that are starting to pick up. It's quite possible that we will start being able to see the patterns depending on more dengue or more cholera or more other kinds of diseases. So that's another strength we bring to the table, and therefore what we have truly done from CallHealth is deal with the clinical issues, but deal with it, but bringing forth the underlying technology platforms and capabilities far higher than what traditional companies would have done. And I'm hoping that we will change the way healthcare will be accessed and delivered in the future. Thank you.